I have the pleasure of introducing somebody that I get to call, I believe, a friend as well as a colleague. He's worked in the behavioral health field for many years in different roles. He's a business owner, a fierce advocate for those with behavioral health issues, and just a beacon in the community with the work that he does. So it is my pleasure to welcome Dr. Chester Wilson today.
Thank you so much, Dr. Buckles. I appreciate it. And I indeed get to call Dr. Buckles my friend. We went to high school together and we worked together, and now we are serving the community together in many different roles. As she said, I've been in the behavioral health field now for approximately 22 years. And in those 22 years, I've been able to work in several positions in the behavioral health field. And with working in several positions, I've been able to help out individuals who are affected by substance use and mental health. Most notably, I work with an organization here in Central Florida who provided a continuum of services to individuals who are affected by substance use and mental health. And so today, I want to be able to, okay, I'm sorry, give me 1 second. It says I need to give you permission to record. Give me 1 second here. It said I need to give her permission to record. I don't know what I just did. It just went off right here. I'm sorry, give me 1 second. Dr. Buckles, I'm not sure if it's recording on your end, but it's telling me she can't record my screen until I quit and reopen. Do you want me to just keep going, or you want me to do that?
Betsy, I don't know. What are your thoughts on that? It is recording.
It's recording. I mean, it's recording for us,
Okay.
Dr. Wilson,
So
but
we won't worry about it then. I'll keep going.
Okay.
It's flashing across my screen that you were trying to record.
Oh, yeah, I am. But okay.
Okay, we won't
You're
worry.
welcome. If you wanted to leave and come back in, we could do that too, but I think that it's recording,
Well,
so.
we won't worry about it.
Okay.
Presentation.
Okay, give me 1 second. It's recommended I come right back in order for you to get the presentation on my end.
Okay.
Okay, I'm back. I apologize. It just told me to do something, so I wanted to make sure that you're able to record the presentation. Are we good to keep going?
Yes. Yep. And now it looks like you're sharing your screen.
Okay, good.
Okay.
So you can see the presentation.
Yes, sir.
Okay. Okay. So as I was saying, my name is Chester Wilson, and I operate two businesses here in Daytona Beach, Florida, a consulting practice where we provide training and certifications to individuals in the community. Most notably, they're aligned with behavioral health. And then I am the CEO for a small infectious disease operation here in Daytona Beach, where we provide HIV services to individuals who are affected by it. Our whole goal here is to decrease the incidences of new spreads. But with the HIV, we also provide a continuum of services under this umbrella. We provide mental health counseling, psychiatric services, case management, intervention, prevention, and medical services. So as you can see, there's a broad spectrum of services that we provide, but our efforts is in creating a holistic approach and treating the whole person. So let's look at mental health in the African American community. What spawned me to deal with this is growing up being a Black male in the African American community. It's often taboo in our community, before and now, should I say, to talk about mental health services. For a person to say that I have a mental health disorder and I'm seeking treatment, even within our own community, it could have been something that has been frowned upon. While we've made leadway and it's becoming more accepted and more common, it still holds that stigma where people don't want to be labeled that I have a mental health problem. And so growing up, having these experiences, and I can even remember becoming a substance abuse counselor, the first thing that I hear from family members and from friends are, you're a counselor, what do you mean you got a counseling certification? Because it's just not an area that we had delved into. And within this presentation, you'll see me talking about the statistics for African American counselors in the field and how this is viewed from not only a professional standpoint, but from a family standpoint. And so we start off talking about some of the common mental health disorders that we see. And by you all being students within this program, these are not new to you. Some of the things that you have heard, such as bipolar disorder, major depression, post-traumatic stress syndrome, bulimia or anorexia, panic disorders, paranoia, OCD, and schizophrenia. These are just some of the most common diagnoses that we hear individuals talking about or even saying that they have. So what is the state of mental health in the African American community? Currently, African Americans comprise 13.2% of the US population. However, out of that 13.2%, 6.8 million or 16% of African Americans are diagnosed with a mental health disorder. This equates that African Americans are 20% more likely to develop a mental health disorder. And some of those things that causes those mental health disorders we'll talk about a little later in this presentation. So the alarming statistic that comes from this is that we have about 7.5 million African Americans that are diagnosed with a mental illness. But the caveat to that is that we have about 7.5 million more Americans, African Americans, that may be walking around undiagnosed or untreated. Why? Because of the stigma that's associated to it, or just simply, I don't know where to get help from. And especially when you're living in an environment or a community where mental health is not a common practice or a common form of therapy, there may be no one there to guide you in terms of where to go and where to get this help. So to some people who are accustomed to it, i.e. me, working in the field, having professional contacts and colleagues who provide mental health care, it may be common practice to me. But for someone who does not have that level of contacts or those associations, they may not be aware of the services that are in the community or even where to get those services. And what's even more alarming that I found out in my role, a previous role that I had, is that individuals still don't know where to seek behavioral health care services for altogether. So we think that it is a common practice. We think that it is something that happens routinely, but we really don't know where to seek those services. So what are some of the issues that leads to mental illness, particularly in the African American community? There's rape by family members, And when you talk about rape by family members, the issue that spawns from this is that historically, especially within the African American community, when there is rape or incest by a family member, that information is not shared outside of that family dynamics. And even sometimes it's not even shared with individuals who are affected by it. And sometimes years later, this information comes out when the person is an adult and have kids or elderly themselves, which means that they have been carrying around this information sometimes for years and decades and not having dealt with it or have the coping tools to be able to deal with it. Incest, and it's not uncommon within some of the veteran generation to find out that children are being fathered by grandparents or step grandparents or family friends or uncles who have raped or molested them when they were younger. Alcoholism and substance abuse is definitely one of the major issues within the African American community, like with many. But the issue is not having the resources or the tools to be able to cope with it, or a person to enter into treatment. Depressive episodes, postpartum divorce. Right now, even in our country, we have divorce that's at a 50% rate of individuals getting married. And even what's more alarming about divorces, and I happen to serve as a family Supreme Court mediator, is that when individuals get divorced, when individuals get married, they're oftentimes planning to get divorced. So when you talk about just how we deal with that mentally, imagine me celebrating the big day, but I'm already planning that if this wedding goes or this marriage goes sour, here's how we're gonna try to handle it. So we are already planning for doom to happen, and we wonder why that takes a toll on us mentally. We talk about the abuse that's never dealt with, incarceration. And when we talk about mass incarceration, this is nothing new to individuals about the mass incarceration of African Americans who are incarcerated at an alarming rate and more compared to their counterparts. Employment issues, the ability to get a job, the inability to maintain and keep a job, or that African Americans sometimes have to prove that they have more than their counterparts in order to be able to get the same level of employment. Poverty, oppression, we talk about depression, we talk about compression, and even still today, although we are decades away from these issues, they're still highlighted in the media where we talk about slavery, racism, biases, and discrimination. We're still yet dealing with the issue of African American men being kidnapped or killed in the media. We are looking at women particularly being kidnapped and placed into trafficking situations. And so these issues are still going on where African American men are scared to get pulled over by the police. So there's just a whole array of issues when you talk about mental health. It is learning to cope within this life and deal with the stressors that's coming with it. If you ask an African American man, i.e. me, we are born with these stressors and we just learn how to deal with them as we navigate life, understanding that these will be lifelong issues that we have to deal with and cope with throughout our life. So we talk about African American mental health professionals. As you heard me say, within the African American community, it is a taboo situation to say, hey, I'm Black and I'm a counselor. While we have made significant progress, and for those that are professionals and have professional colleagues and contacts, it has become more accepting to say that. But if you ask my grandparents or my great grandparents, counsel what? Because it's not the form of therapy that we've been accustomed to dealing with. So as a result, if you look at where we are today, 2021, African Americans, according to the American Psychological Association, we are only 6% of its members. 6%. That means that 94% is another race, and African Americans are only 13.2% of the general population. Only 2% of African Americans are psychiatrists, 2% are psychologists, and 4% have some form of social work labeled to them. And this is in the American Psychological Association manual. Here's the issue with this, which means that I, as an African American male, if I present for counseling, there is a 94 to a 98% chance that the person on the other side of the desk that's providing therapeutic services for me may not look like me. That also means that when it comes to best practices for African Americans, they don't exist. And what's alarming about that is that when you look at the LGBT community, when you look at our white counterparts, even the Hispanics, they all have best practices when it comes to therapy in terms of what works for that population. Now, one may ask, or one may say, well, the reason why we don't have those best practices is because African Americans don't engage in mental health services. Well, when you look, if you go back to what I said earlier, when you look at a distrust in the system, when you look at that there may not be anyone who I feel like I can identify with or I can have that conversation with, then we're more reluctant not to seek those services. It doesn't mean that someone else of another race cannot be just as effective. But when you take an African American man, for instance, with all of the stressors that we have to deal with, on top of the racism, the homelessness, the jobs, the education, sometimes it is necessary for us to have someone that we identify with. And given that I cannot identify, the other person on the other end of that counseling may not understand the stressors that I go through. They may not understand the issues that I face on a daily basis. They cannot identify when I say that I'm walking while Black, or talking while Black, or driving while Black. They may not be able to understand those phrases, and not being able to understand those phrases sometimes turns us off from counseling, because then we feel like the counselor is ineffective or unable to walk in our shoes. It is a fact, as you heard me say, that African Americans are 20% more likely to experience factors that increase the risk of developing a mental health condition. This includes witnessing or being a victim of domestic violence, homelessness, all of which leads to psychological issues. And what happens is that when you have these two factors, which are huge in the African American community, it hurts the person's self-esteem, the person's willingness, the person's ability. You beat them down to a position where they feel hopeless. And certainly if they lose the ability to have a stable place to live and to work, schooling, if they lose all of those things and they become a victim of homelessness, it's almost guaranteed that they may not bounce back from that without the right help and or interventions. So what happens when an African American is left untreated? For African American teens, they are more likely to attempt suicide. Recent research shows that African American female teens are the leading group among suicide right now, which means that they're the ones most prone to take their lives. Suicide has become the third leading cause of death among African Americans. It leads to depressive issues, victims of serious violence, because when people don't have an outlet and people don't know better, their recourse is violence, particularly domestic violence. Schizophrenia is a cause, and individuals suffer with post-traumatic stress syndrome and struggle just to make a daily living, or even to live throughout the day. So there's this code in the African American community, which is the code of silence. That code of silence tells us that who we can and who we can't talk to within the African American community. In the African American community, one of the things is that if you take information outside of the house or outside of the home, you'll be shunned, because you'll be labeled as not being able to keep a secret or not being able to hold on to the family issues. So particularly within the African American community, we don't take information outside of the home. The only people that you share information with are the matriarchs or the patriarchs of the family. And then if it gets too much for the family to handle. Then that information is shared with the pastor, which we'll talk about later. But it is expected that you keep the secrets in the home. So we go back to what I said earlier when you say, why don't African Americans seek counseling? We've been trained, we've been groomed from the time that we were born that what happens in my house stays in my house. It doesn't go out. And so when you are reared with that type of thinking of what goes on in your house and it stays in your house, when you become an adult, you're only emulating what you learned as a child. And so now we sit on someone's chair, someone's couch for a therapeutic environment, and you're saying, tell me all of your life secrets. Well, I've been groomed not to tell you those secrets. It's kind of like the old adage within the home for a Black man, where we say, don't cry. You better not show a sign of weakness. You better not shed a tear. But then when they become men, what's said is, you don't show emotions. You don't tell me what's going on. Well, I've been trained all my life not to. So in essence, we're trying to deprogram what has been instilled in us all of our lives. So yes, there is a code of silence among African Americans. And that code of silence is, you better not tell anybody but God. You heard me talk about incarceration being one of the issues that we face. African Americans are 1 million of the 2.3 million folks incarcerated. Now, remember when I said to you earlier that we're only 13.2% of the population. So 13.2% of the population, but 60% of the prison population. African Americans are 30% of the drug arrests that happens, and only 14% of drug users. What's interesting about this is when I ran delinquency programs, it was full of African American. When I ran substance abuse programs, we found that it was full of white Americans. Well, if you ask me what the difference is in here, African Americans, it is instilled in us, it's a bad thing to say we have a drug problem or a drug addiction. We, as African Americans, and I say we loosely, not me, but we would be willing to take a felony than to admit that we are a drug addict. It's the way that we've been programmed. For some reason, drug addicts are worse than other people who commit crimes. But when you look at these numbers, it's astounding. But that even in looking at these numbers, it does not take away of the issue of mass incarceration among African Americans. So what prevents African Americans from seeking treatment? There's an abundance of issues. Fundamentally, the lack of information. We just don't know. We're being asked to seek something that we've never been exposed to. We don't know. We don't even know where to start or where to get it from. For those of us who have become educated or connected, we're learning where these connectivities happen. But historically, where do we go? You just wake up in the morning and you say, I need help. I'm not even sure where to start. So although the information may be out there on the World Wide Web, it may be in pamphlets, people may say, well, this business is well known. If you've had no reason to seek those services, you would not know about those services. Then we talk about the misunderstanding about mental illness. The misunderstanding is, and you've heard these terms before, you're crazy, she's not in her right mind, something is wrong with her. No one wants to be labeled with that. And so with that stigma being out there and names being called for individuals who do have a mental illness, no one wants to be associated with that misunderstanding. Not recognizing the signs and symptoms. Within the Black community, you've heard me say before, heard me say earlier, is one of the ways that we recognize mental illnesses now is we look back and say, you know, we always knew something was wrong with that person. They were displaying signs and symptoms, but we were unable to attach a name to it. I know I didn't hear about it until my college days, but now that I look back, I can say, oh, I saw that while I was in church, or I saw that from my friend's mother. You know, now I know that it was a sign or a symptom. But for most people who haven't been educated to it, they don't know what those signs and symptoms are. Fear of what other perceptions may be about us, especially Black men, it's perceived as a sign of weakness. It's perceived as an inability to function. Other people perceive that we are less than if we say that we are diagnosed with a mental illness. Luckily, we have celebrities, stars, and leaders and other people within our communities and nations standing up. Taraji P. Henson is one of those people who are appearing on national TV saying we want to make it normal, especially for African Americans to say, I need help, I need counseling. Then there's a reluctance and an inability to access services where people don't know or they don't have the means or the funds to access those services. And for those services that do provide community treatment, sometimes the wait list is beyond reasonable, where the person is progressively getting worse because they have to wait to receive services. Then there's the distrust and misdiagnosis, where we African Americans don't trust the system. And that is with good reason. With all of the things that have happened in the past and experiments on African Americans and African Americans getting the low end of, of every stick, socioeconomic facts, and then even racism and microaggression from therapists, where the smart comments come or they make you feel like you're not really experiencing what you feel. And remember, that goes back to what I said about some therapists who are of other races may not be able to identify with some of the things specifically that are plaguing African Americans and especially African American men. And I even say this about African American women. Some of the things that we go through as African American men and have to deal with often sometimes can't even be understood by African American women, although they have some of the similar experiences. So some of these things that we, particularly men, go through may be limited to our experiences, and without someone understanding those experiences, they may not be able to help us to cope with them. So what are some of the methods of counseling in the African American community currently? This is what they tell you to do instead of getting mental health treatment. Go to your patriarchs or your matriarchs. These are the grandparents within the communities. They were seen as the counselors. They were seen as the healthcare workers, the child social services workers. They had every role within the family, and that's where you went to get your wisdom. Again, you didn't take it outside of the house. These were the two people that you went to for your wisdom. Then you better not tell anybody but God. You go to your pastors, who may or may not be equipped to deal with the issue. And within the African American community, it's customary to go to the pastor to handle your issues, including divorce, child custody issues, because pastors are seen as a source. And so if you have pastors who are taking on the issues but are not equipped to deal with them, it may place the person at further risk. And other things, they just tell you to pray it away. Even when you're dealing with LGBTQ issues, the African American family really can shun you on some of those things. And what they'll tell you is pray the gay away, or pray the mental health away, pray the issue away. Meanwhile, you're still suffering in silence with it. So what happens is that when this information is unresolved or the answers are unknown, it goes to the grave, which means that if you've been raped, if you've been molested, whatever issues that happen in the dynamics of the family, you just deal with it until the day you die. And then that information goes to the grave, which may hurt people that are coming behind you. Because I don't know that my mother or my grandmother suffered with mental illness because it was never said. And in some cases, back in the day, they would just put you away privately, and then you would come back like nothing had happened. So us not knowing the historical sketch of our family when it comes to mental health issues, oftentimes we can repeat that same thing. We can repeat those same behaviors. And we all know that early intervention and early care is the key to stability and cure for certain things. But here in the African American community, those things aren't discussed. It just goes to the grave. And then we also have this thing of not my child. when you see young children exhibiting mental health issues, substance use issues, domestic violence, the first knee-jerk reaction, especially from the African American community, is not my child. My child does not have these issues. Or my child is not. And again, I go back to what I said earlier. Black parents, we would teach our children that it is better to take a felony than to be labeled a drug addict or have a mental health issue. Whereas it's common for a white person to go to the courts and say, hey, I have a drug problem. I need drug rehab. Very seldom do you hear black parents doing that. And so understanding the dynamics of that is that not my child is normal, also places us at disposition. So what are the modern day stressors that increase the mental health issues that we talk about here? New substances and drugs are coming out every day, and we know substances and drugs can help exacerbate mental health issues that are already there and maybe lying dormant. Accessibility and availability of drugs, domestic abuse, and then there's social media and reality TV. There's so much stuff being put out there where we are watching individuals die on social media, get shot on social media. Television is replaying the same thing over and over until it's stuck in our psyche, and we wonder why we're not able to deal with that. So you take a population such as African Americans who already have these stressors, and you add these additional stressors to it. Reality TV is made up, especially of African Americans who fight for entertainment. It's a way of living for them. It's a reaction for them. So let's talk about it. How can we deal with this issue? African Americans fail to talk openly about mental health and substance abuse and do not seek help. We need to encourage our family members and our friends. It's okay to ask for help. This is not a taboo subject. We need to stop fighting and posting it for the world to see, reality TV, social media. We need to stop glorifying our young kids having babies and raising them by themselves. It's like, oh, we're just gonna have a bunch of babies. We're the highest rate among HIV. And because we don't understand it, mental illness, we don't talk about it. And by not talking about it, we end up not seeking help. So what do we do in this case? We break the generational curse by seeking help. Understand it's not taboo to ask for help. Our goal is to become educated regarding behavioral health services. That includes mental health and substance abuse. When we're educated, we can make an informed decision about that. That is my presentation. And as you see there, you can follow me on social media if you choose to. And now I will open it up for the most exciting part, which is the question and comments.
And I think you can just go ahead and unmute yourselves if you want to share your camera and ask the questions directly to Dr. Wilson. Dr. Wilson, that was fantastic, and thank you so much.
Thank you.
Yeah, I had a question. Hi, Dr. Wilson. How are you?
I'm doing well, thank you.
Thank you for your presentation. Very, very helpful. I had sort of like a two-part question, just to give context. I'm an associate professor in the Department of Mental Health Law and Policy, clinical social worker. So most of my research focuses on barriers to mental health service utilization for racial and ethnic minority communities, and also focuses on looking at how to adapt evidence-based interventions to be more culturally sensitive, and have engaged in a few programs recently that have been focused on spreading awareness, raising awareness. One of the programs is called This Is My Brave, Stories from the Black Community, where we've recruited African Americans from across the country to bravely share their stories of mental health, substance use and abuse seeking treatment. And they do so in creative and artistic ways, spoken word, poetry, song, monologue, etc., to help to reduce stigma. One of the two of the things that come up very frequently, however, is that even for folks who do want to get help and are beginning to, as you say, recognize that this should not be taboo, finding places to seek help that are culturally sensitive, recognizing that in the majority of circumstances, the clinician who they're going to be work with is not going to be a person of color. You know, how do we begin to bridge the gap if we're trying to get people to go seek help, but then the options for seeking help often can be re-traumatizing for folks. And so that's the first part. And then the second part of that question is along that same line of trauma. One of the things that I've been focusing on a lot recently is this issue of trauma, historical trauma, current race-based trauma, and that clinicians often are not trained to assess for race-based trauma, to assess for an understanding of how historical traumas may be compounding current race-based trauma that can be triggering a mental health condition. What strategies or techniques have you used or do you suggest for clinicians of color and otherwise to be able to accurately assess for race-based trauma and to treat it in a clinical setting?
Well, that's where I feel like a holistic approach works. And that's what we try to do here in our practice, where we try to treat the whole man. And in treating the whole man is assessing the whole man, not only current issues, but historical issues. If a clinician is really clued in and really using motivational interviewing strategies correctly, then there are certain cues that your patients will give you that will tell you that you need to take a deeper delve into what it is that they're saying. For instance, when they're telling you they're having a hard time getting a job, well, let's explore why you're having a hard time getting a job, because I'm sure that there's some history that may be there that may be preventing it, whether it is your perception or whether it is the way that you're presenting yourself, or continuous medical issues. Continuous medical issues tells me that there's some history that's going on with medical issues that could have stemmed from rape when you were a child. That we're still dealing with the remnants of it now, of your bodily organs that are not functioning correctly. So we have to be trained to explore every aspect of the presenting issue that's coming to us, and exploring traumatic histories and racial histories. It should be an automatic part of the assessment. And so to answer your second part about the dealing with the fact that when you go to therapy, there may not be a person sitting across from you that looks like you or identifies with you. Here's where I believe we have a responsibility as African Americans in the field, is to ensure that we are ensuring that other up and coming students who are selecting majors, especially I served as a college professor for almost 15 years. It's my obligation to make sure that they are aware of this field and that there is a need in this field and some of the issues that we're facing. Because without people like us, there will not be best practices that are developed to learn how to treat us. One thing that we don't want to do as professionals is that we are too busy to groom other counselors. Yes, the counselors need to sit at our feet. They need to study under us. They need to learn some of the barriers that we're facing. And then we need to support them as they're going through graduate school in order to obtain licensure to get out there and treat themselves. But sometimes along the way, professionals are just too busy to help other people.
Thank you.
You're most welcome.
If no one's going to ask another question, I'll just ask a quick follow-up about because I'm really curious and interested in this. Do you have any standardized like instruments, tools that you use for that sort of whole body, whole person assessment? Again, I'm specifically interested in sort of this idea of being able to tease apart and better understand race-based trauma and specific racialized stressors. As a person of color, when I meet with someone, I have insight into that. So I can sort of ask those questions without maybe needing a tool or instrument, but it seems like perhaps that may be something lacking for the field, especially for clinicians who are not from a racial ethnic minority background to know what are the right questions to ask. And so I've been sort of looking through the literature trying to find, we have all of these standardized measures for being able to understand and assess for depression and anxiety and a whole host of other things. Do we have something that has been standardized that we can use to address racialized trauma experiences? I read a study once that I was looking into that said that, and I haven't looked at it for the DSM-5, but I know the DSM-4 rarely ever even makes mention of issues like racism, discrimination, and prejudice, and don't really identify those things as being risk factors for these conditions that we know that there's a connection, but clinicians who are not from that background are not making those connections, and that's a huge missed opportunity that could perhaps help build that bridge, especially when you are sitting across from someone who is not from your background, which is what's going to happen most often. How can we help those clinicians who are not from racial and ethnic minority backgrounds be better prepared to address those situations in the clinical setting?
The most effective way that I think personally is it comes from training, because any clinician that gets out of school, we know now that school does not necessarily prepare you for what you're going to encounter in the workplace. It gives you all of the theoretical perspectives. And I'm saying this as a college professor. We give you all the theoretical foundations of what you will encounter and how you can handle it based on theory. But for those of us who have practiced any short while, we know that the practice can be totally different than the theoretical models sometimes. And those real life situations don't necessarily always align with a theoretical model. So it's not saying that throw the theory away. It's saying be prepared for real life situations and real people that present that may not fit the mold of what you learned in a theoretical class. And so with that, what I understand is that you have to train the clinicians in terms of what to look for. No, the DSM is not going to point out that these racial barriers are a factor in the diagnoses. The reason why is because there's no best practices for us. They don't have enough data that says, here's what is wrong with African Americans and here's what treatment works for them. So what we have to do is we have to train the upcoming clinicians that systemic racism, race-related issues, all of these issues we have to probe for. So automatically, when you get an African American patient, this guide or assessment that we use to ask questions, here are some extra probing questions that you're going to have to ask for this particular race. Now, make no mistake, the LGBT community, the Hispanics, the Mexicans, they will tell you up front, you didn't ask these questions. It's only in the African American race that we don't have this data, we don't have this information, and we're not probing for it. We know what the problem is. We absolutely know, and especially for those of us who lived a life as African Americans and are practicing in this field, we know what the problems are. Well, what happens is that we have to be the change agents, we have to be the game changers, we have to be the people that say, now that we're here, and we're looking back, here are some of the things that's missing from clinical practice. If you want to be effective in a holistic approach, then here are some of the things that you're going to have to consider. And when I think about how we manage it as a holistic approach, we have a very good team here who comes from all of these angles. And this is why a diverse team is important, of African American counselors, white counselors, Hispanic counselors, because each of them bring a unique perspective based off of what we call in research phenomenological or lived experiences. They bring that to the practice. And because they have those lived experiences, they're able to really work as a multifunctional treatment team and really ask the right questions. Because what I may fall short on because of my experiences as a Black man, I may go straight to that and say, oh, well, I can tell you why he's having some of these stressors. It's related to his inability to get a job or homelessness, because my mind automatically goes there based on what I see in my community and what my experiences are. Well, a Hispanic may come from a totally different mindset, or someone who's Asian American may come from a totally different mindset. A multi-cultural treatment team is very necessary in providing care for everyone that you are servicing in your organization, it is imperative that you have someone in the organization that looks like them.
So, Dr. Wilson, we have a student who can't unmute, but she had put a question in the chat. So I'm going to read it out for you. Her name's Erin. And she asked about family involvement. How can we get the family involved surrounding an African-American client who feels as though they would benefit from their family participating in the therapeutic journey?
What I feel is that you have to offer family counseling, but don't hold out on the hope that family counseling is going to be an integral part of therapy services with an African American. And the reason that I tell you that is that with the matriarchs and the patriarchs, our parents of old, they're still not totally sold on this idea of sitting on someone's couch and them telling me what to do and how to live my life. So that I don't want to mistake that should be a barrier that should be placed upon the person who is seeking help. Here's what I learned when I was dealing with incarcerated youth. I used to go in and I had the mindset, you know how we were all fresh out of college and we want to change the world. I went in with this mindset that I want to change the world, and a very wise African-American counselor told me, he says, Dr. Wilson, I think it's notable that you want to change the world. But what you have to realize is that we're not going to get the buy-in of the parents. And these clients are going back home to their parents who do not buy in the ideals of therapy. As a result, the strategy that should be used is teach the client how to survive in the environment in which they live, because they are going back home. We can't take them out of their environment, but we can teach them how to survive in their environment. When you see these stressors, when you see these issues that present, this is where you need to figure, I need to ask for help. I need to get back engaged in services. You can't change the parents, you can't change the uncles and the cousins, but what you can do is work with the person who's willing.
I was muted that time. I said thank you.
You're most welcome.
And Dr. Dillahunt, I don't know if you want to unmute or if you just would like me to read, but Dr. Dillahunt had also asked you, like, what helps you the most when you are working with counselors in training, and what are one or two takeaways that you want them to kind of get out of that?
One of the things that I say when working with counselors in training is you have to pay attention to their styles and their techniques. Why do I say that? Because every style and technique is not effective with every patient. And for anyone who's been providing services for a while, we've learned how to adapt to the different patients that come through our door. There are some things you know you can push, and some things you know that you can't push. And so what I would tell clients to take away is that you have to have the ability to know when to push forward with the client to get them to open up and when to pull back. Some counseling sessions, especially for, it's like going into the Hispanic community, they're just like African Americans. They have their own little network that if you're not a part of it, you're not going to get into it. And so this is an opportunity where you have to let nature basically take its course. You got to develop a relationship with them, get them to trust you, get them to open up to you. That may not be therapy overnight. And for some counselors, we feel like if we can't make a breakthrough right away that day within a certain amount of time, then what ends up happening is we disengage. We begin to lose hope. We say there's no therapeutic process. But when you are counseling people of other races, and this is for all new counselors out there or aspiring counselors, when you are counseling people of other races, a therapeutic relationship takes time. Be patient. And remember this, the counseling session is not about you and the progress you want to make. It is about getting the client to the place that they need to be. And if we remember that as counselors, that it's not about us, we'll be successful in our practices. Sometimes we take it personal, Dr. Buckles, when we're not having that therapeutic breakthrough with a client. He's not getting it. He's not, and I'm telling him to do it. Well, him doing it may be harder than you saying it. We have to remember it's about developing the client and not us as counselors.
My most common statement that I think I shared as a clinical supervisor was, if you're working harder than the client, there's something wrong. So you have to sometimes back off, because us trying to force our agenda on a situation may not be effective. And that's where, like you mentioning motivational interviewing in the beginning, and I'm a big proponent in utilizing motivational interviewing as a communication strategy, and just being able to establish that strong collaborative therapeutic relationship, and it doesn't happen overnight. So thank you for that. And Dr. Dillahunt had said thank you as well for that information. Or Ariel did, sorry. Dr. Chu also said, what are your thoughts on how to encourage more male students with minority backgrounds to come to the field?
And that's harder said than it is done, because one is, again, there's that taboo thing that's going on, but you can't assume that they know about it and that this is an option. Most times, most of us are exposed to this is when we get to college, and it's like, oh, well, that is a thing. You actually can make a living off of that. So I think that it just comes to exposure. There's no magic pill for it. Like I said, I lived in Palatka, and I didn't even know that they locked kids up before I moved away. Now that I think about it and I look back, I found out, oh, when they say a person was sent off, that's what that meant. So it wasn't until I became an adult that a kid disappeared from school. You didn't know, because they hid those things from us. And so I'm saying that is that there's just a lot of things that we're not exposed to. There was a comedian who once said that common sense is not common sense until it's taught. It's the same thing when it comes to these careers. We don't know unless you tell us. I became a Florida Supreme Court mediator somewhere along the way in my career. I didn't even know it was a thing, and I didn't even know it was attainable. When someone exposed me to it, then it was like, oh, okay, well, here are the requirements. I can do that. I'm halfway there. So I think for that, Dr. Chu, is that one of the things you have to do is you have to just expose those particular communities, those minority communities that are not just limited to African American men, but certainly African American men. You have to expose them that this is a career option. And especially when you, as a clinical supervisor, Dr. Chu, Dr. Buckles, when you all see this in a person and you see that they have a foundation or a skill set and they can be good at this, then we encourage them that this may be a route that they can take.
I'm going to open it up. Does any other students or anybody else in the session? We have a few more minutes for questions. Does anybody else have a question for Dr. Wilson? And wrapping up, Dr. Wilson, I just would like to ask you a question from my perspective, because kind of like you've talked about the lived experiences. As a clinician who doesn't have the lived experiences, what can we do to be better prepared or to function as more aware counselors in the field? What are your thoughts on that?
We have to be open that everyone is not going to have the experiences that we have. Even as an African American, and now that I'm exposed to this world and I live in this world, oftentimes I still feel like, well, I learned it. Well, somebody else may be able to learn it. We as counselors have to really focus and understand that everyone is just not going to have the experiences we have, and that's okay. But what we do owe our clients that are sitting in front of us is to educate ourselves, and that is to ask questions. Did I explain this right? Did I understand you correctly? Is there something better I can do to understand you? How can I make this therapeutic relationship better? And we have to kill the assumptions altogether. Well, I went by the book, I went by the DSM, I went by those things are not going to tell you what's not known. So we have to make sure that we put ourselves aside when we have these therapeutic relationships and really explore, ask questions. That's what we do as counselors. We ask a lot of questions, get clarity, understand, and ask questions again, and make sure that we're open to learning. If you know that your practice is going to be targeting African Americans, Hispanics, Asian Americans, Latin, if you know that your practice is going to be, don't wait till they sit in front of you to learn about them. Start studying now so that you can be prepared when they walk through the door. And even studying is not going to teach you everything, but at least you would know how to interact with that population when they walk through the door.
Absolutely. Thank you. There's one more question that came in from Riley, and he was asking, what advice would you give a future Lmft when serving the African American community. And he specifically was asking about like, what techniques do you think are most effective when building rapport and trust with an African American client?
The technique that I feel personally, and I'm not every African American, but it is taking time and getting to know that client. As African American men, there's been so much years of distrust that we're not going to walk in and trust anyone easily. You have to earn that trust as a counselor. And when we do start talking, you have to understand you're guarding our most deepest and darkest secrets that we wouldn't ever verbalize out loud. There is some stuff we're just going to take to our grave. And in order to be in that position of an Lmft and working with African American clients, just know that your patience has to be on a level that we haven't even discussed yet, because it's going to take a while to get there for that client to have a breakthrough and decide to tell you. One day you may have had months of just talking at an issue, and then one day your client may walk in and break down. That means they've gotten to that breaking point, but it's going to take patience. It's not going to develop overnight.
And I just wanted to kind of say this because Dr. Connor also shared that she thinks that we could do a better job in our academic programs at, being more focused on coursework around developing cross-cultural counseling, role playing around assessing race-based trauma experiences, and cultural humility training, things like that, and how that plays into it.
And I echo that by saying I've been doing a lot of work with schools, especially our grade schools, high schools, and middle schools, and even the police departments on cultural diversity and how these issues play a factor into what we're doing. Because I'll end with this, Dr. Buckles. What we don't want to happen as counselors, and especially with everything that's going on with the civil unrest in our country, we don't want to be the next national media story because something went wrong in our practice. And so it behooves us to prepare ourselves.
Absolutely. And I think that is a wonderful ending point. I greatly appreciate you sharing with us today, Dr. Wilson, and all the information that you have provided us with.
Thank you so much for having me.